I'm Vicki Toller. I'm Chief Allied Health Instructor here at Lincoln Tech, Allentown, and I am in charge of the Allied Health Medical Assistance Program we have here, a 9-month program. We start our students off with Student Success, SSS 150, get them used to being back in a classroom environment, get you used to working with their classmates as well. The students then take a Bio 101 and 102 class, which is Anatomy and Physiology, Introduction to the Body, the Systems, the Organs, and then Medical Office, which starts off in the beginning of this classroom, has a computer desk where the students can come in, simulate being a patient, simulate being the MA who's taking the history of the information from the patient, setting up appointments, and then we actually move to the back of the classroom where we start with clinical procedures and working and showing the students how to do examinations, EKGs, and stuff. So let's take up front to the classroom. So this is the front of the classroom. This is our clinical procedure doc office room. And as you see, we have some of the equipment that we work with and show our students. We have exam room tables. This table is specifically used for like lithotomy positions, for OBGYN appointments for patients. Our exam tables have the curtains that kind of give the privacy for the students so they can actually simulate hands-on work with the equipment. We have EKG machines. We have 4 in this room along with the exam tables. So we show you how to put the electrodes on in the right format, in the right flow. We have our electrodes and then we have our EKG machines. So we'll walk through and show you actually how to do that and reading the EKG and get an idea of what's normal, what's not normal. We have our pediatrics, which is always an interest for our students, showing how a baby is measured using the weight, temperature, and we have our new cool instrument that's used out in the field now. So society is going with the non-contact thermometer. So we have those so we can show you how that is actually done. We have some of our other equipment, just doing physical examinations that a doctor is going to do to a patient. You're going to assist with all that. So this is our exam, our doctor's office. So one of the other pieces of equipment that we teach you how to use for just daily routine visits a patient might do is our scale. So the scale does the height and the weight of a patient. So we'll show you how to use this equipment and how our vital signs, blood pressures, pulse rates, respiration, all those vital signs are key to learn so that we can help the doctor in making diagnosis and treatments for our patients. So this is our scales that we use, and we also have our Snellen chart, so we do some eye exams as well, which is one of those techniques that medical assistants do out in the field. So we're going to take a walk over and I'm going to show you our lab. So this is our lab, our phlebotomy room, and we do all our hands-on lab in this room. So it's really kind of an exciting room, especially for us and for the students, because they can touch the stuff and play with the stuff and do these techniques on their classmates. So we have, it starts off with the PPEs, which is personal protective equipment. You know what, 6 months ago, never would have had to explain it. Or would have had to explain it. Now I do not need to explain it because I think everybody understands PPE in our situation. We have peak flow meters for respiratory. We talk about the nebulizers and the equipment used for the respiratory system. We have glucometer meters, which is the finger sticks to check our glucose, our sugar. We get into the urine dips. We show all different types of ways of testing someone's urine. So not only just a quick little dip, but pregnancy tests. We do specific gravity. We show you actually the catheters as well. So all these different types of techniques that we can be using out in the field. Grim standing is the microscope. Really kind of cool lab. You get to go around the school, swab something, swab your neighbor, swab your shoe, your car, and then you're going to look under the microscope. We're going to grow it and we're going to see how it is. Then you're going to, over here we have some strep cultures. So we talk about the throat. Doing the cultures and tests for strep tests. We have mono, which is a finger stick. We have our blood typing. So we can show students all these little labs that you might be doing out in the doctor's office. We have our supplies for wrapping, bandaging. Patients come in, they're all different shapes and sizes and different type of wounds. So we get to play around with some of the gauze and some of the tape and different situations and use that critical thinking skill that we have. We have an autoclave over in the corner, and I'm going to take you over on this side of the room and I'm going to show you some of the wrapping. So this is autoclaving. We have two machines that we use. So we actually have you wrap the equipment up. So we have our equipment showing you how to do the different wrapping techniques and then using the machines. Our equipment is pretty standard what's used out in the business and out in the world. So you can be accustomed to using it here, playing with here, practice it here, and then get out in the field and start using this equipment. In the back corner, we have our phlebotomy rooms, the phlebotomy arms that we use for practicing for sticking, but we also do live sticking. So you can actually stick your classmates and bring your family and friends and stick them as well and practice that technique once you have it all down. So I'm going to show you the phlebotomy technique over on the other side of the room. So what we have here is our phlebotomy equipment, the venipuncture. So we actually stick, after you get signed off on the technique, sticking each other and maybe some people from the outside, your friends, your family, we bring visitors in. So it actually shows you how to use all this equipment when there's blood draws. So when a patient comes in and needs a blood test done, you're the one drawing the blood up for that specimen. So we show you all the different type of equipments. We have two different systems that we use, a vacutainer, and then we also use the butterflies as well. You'll be doing both. We'll also have you learning the color of the tubes. Every color means something. Every type of tube has additives or serums inside of it. So we'll teach you how to process these, because it's so important to process them correctly, so when they get to the lab, the results are correct when they are produced, and then the patient can find out what's going on or know that they're all okay. So we also show the equipment that's used with this. It's called a centrifuge. So it spins certain specimens like this when it's necessary. We'll walk through and when we have labs, it might have to sit for 10 minutes before we actually spin those down. So we walk you through, and we actually get you to play with this stuff, and you can draw the blood. So as you can see, we have quite a few different colors that we do. And the exciting part about the venipunctures is when the students get a successful, we use a lot of times a system, and I'll show you one of the boards from one of our classes. So it has the student's name, and when the student get a successful stick, meaning that they got blood in their tube, they get a sticker. So this is a visual excitement for the students, because they can see, wow, this is how many sticks did I get? So they can go through and they can see, they get butterflies, they do straight needles, and they can swap out tubes, and we teach them all those techniques.